Dr. Samuels, we talked quite a bit about periodontal disease and what havoc it raises. Can you tell us a little bit of just the way you did with crowns and with missing teeth and implants, of like what methods exist of fixing them and what stages are there, meaning, what treatment do we need for what stage? Can you take us through that ceremony?
Sure. There are basically 4 different classifications of gum disease. The first is gingivitis, which is the easiest to get rid of. Gingivitis is just the very, very early signs of gum disease. It's when the bacteria has gotten underneath the gums and has caused a little gum inflammation, a little bleeding of the gums. The way we treat that is through a good dental cleaning and then proper home care at home, brushing and flossing. And then you're done. Then there are 3 stages. That's called gingivitis. Then there are 3 stages called periodontitis. There's early periodontitis, moderate, and advanced or severe periodontitis. And those are different stages of gum disease beyond gingivitis. Gingivitis just affects the gums. Periodontitis gets underneath the gums and starts affecting the bone. See, gum disease is really a disease of bone, much more so than a disease of the gums. Once the bacteria gets into the bone, that's when we start having problems. If I was to show you, I don't really have any props here, but let's say this is a tooth here. These are the 2 roots, and this is where the bone is. With gum disease, the bone starts to disappear, and eventually these roots will just fall out because nothing's holding it in. That's what happens with gum disease. The bone starts to disappear. So, in early gum disease, we have gingivitis. The next stage, early periodontitis, we start losing some of the bone, but it's still very quickly reversed. In moderate gum disease, now we've lost 20-30% of the bone, and it's not as easily treated. It requires a series of deep cleanings where we remove all the bacteria, all the chemicals, the toxins, the tartar, the calculus, plaque. Everything that's underneath the gums that causes a disease needs to be removed. Once that's done, we need to have you work, very diligently at home with the brushing and flossing, and we need to see you back several times in order to make sure that those gums will heal properly. But moderate gum disease is also very controllable. It's the advanced or severe gum disease that is a problem. If you've already lost 50, 60, 70% of the bone, well, the teeth have already loosened up. So yes, we go through a series of very deep cleanings. Sometimes you need gum surgery, but we still have the problem in that so much bone has been lost that the teeth are a lot weaker. So it will create problems down the road, and you may not be able to save your teeth once we're into advanced periodontitis. So it is best to, as they say, nip it in the bud, get it in its very early stages, and if you correct it when it's still gingivitis, then you won't have any bone loss.
All right. So basically, there's first, I guess, the brushing and flossing, then there is the cleaning, then there is some kind of like a deep scale cleaning, you just, scrape in it more, and then there is right out surgery where you need to cut in it and do that. Now, in terms of surgery and gum disease, are there lasers available these days to do this work? So you don't have to, it's not so painful anymore or not so bloody anymore?
Well, there are laser treatments for gum disease where that's actually non-surgical, that you actually place a laser underneath the gums and you move it completely around the tooth and it will kill the bacteria. So in certain cases, we can use this laser treatment, but not all cases. If it's advanced gum disease, once again, if we go ahead and use a laser, it'll kill the bacteria, but it's not going to change the fact that you've already lost all this bone. So in those cases, I actually think that the best treatment would be surgery, because in certain situations we can actually do bone grafting and try to build back some of the bone that was lost. But yes, laser can be used today.
Where does this bone come from which you put back on?
Sometimes it's taken directly from the patient in areas if there's thick bone around the outside where you don't need it. It's taken from there and it's put in. Other times it's artificial bone or it's actual bone products from a cow, bovine bone. There's a lot of different sources, many artificial sources now. And those sources, when mixed with your own platelets and your own bone, that seems to have the best regenerative possibilities for you.
I see. So no need to show up with a chicken in your office.
No, a cow does work sometimes, though.
Okay. All right. Well, all right. Thanks for shedding light on this whole thing. It's again, and your message sounds true that you just gotta take care of it, at the beginning.
That's really the truth.
Because obviously to replace, to do bone grafting, building up the bones, I mean, no matter what, no matter how successful of an operation it is these days, why go through, why have to do it if all you need to do is not just brush well, because that might not be enough, but go to the doctor, and if there's a little bit of work, needed, go and do it, because then the big one will never happen.
That's sound advice.
Well, all right.